I'm Dr. J.C. Alvarez, joint replacement surgeon at Florida Hospital Heartland Division. I wanted to talk to you today about new developments in rapid recovery joint replacement. I'm an orthopedic surgeon with Florida Joint and Spine Institute. We are a group with 7 physicians, 6 orthopedic surgeons, 1 interventional physical medicine rehabilitation specialist. Our physicians have trained in some of the most prestigious programs in the world, and many of us have had further training in robotic and computer-navigated surgery. We are the largest orthopedic group in the area. We have Ivy League trained surgeons and Mayo Clinic trained physicians. Our surgeons have trained other surgeons. We have joint replacement surgeons, foot and ankle specialists, surgical and non-surgical spine specialists. The interventional physical medicine and rehabilitation specialist specializes also in what we call PRP, which is platelet-rich plasma treatments, ultrasound, and stem cell therapies. Our Florida Joint and Spine Institute doctors are Dr. Soni, Dr. Beisinger, myself, Dr. Reddy, Dr. Fisher, Dr. Dos Santos, and Dr. Zarai. We have trained at, like I said earlier, at some of the most prestigious institutions in the country. I trained at the Hospital University of Pennsylvania. Dr. Reddy had trained at NYU in New York City. Dr. Beisinger trained at Duke University. Dr. Dos Santos trained at the Mayo Clinic. Dr. Soni trained over at Mount Sinai, and Dr. Zarai did his training at Grady Memorial. Dr. Fisher trained at Alton Ochsner. And I had the privilege to do a lot of joint replacements in my training at Pennsylvania Hospital, which happens to be the first hospital in the United States. And it was pretty neat to do 16 to 20 joint replacements, and at the end of the day, walk out in the hall and there's the Philadelphia tour group going through the hospital, because it was part of their stop after they saw the Liberty Bell, was to go see the first hospital in the United States. At Florida Joint and Spine Institute, we've seen tens of thousands of patients, tens of thousands of surgeries performed, hundreds of joint replacements done every year. Pretty much there's a Florida Joint and Spine Institute surgeon in the operating room every day of the week. I was actually in the operating room earlier today. Joint replacements are being performed on a daily basis, and we've demonstrated superior surgical outcomes using objective criteria. There are some new cutting-edge technologies that we're implementing at Florida Hospital Heartland Division that I would like to share with everybody. We are using, Dr. Dos Santos is using novel non-operative treatment. She does stem cell treatment. She does something called platelet-rich plasma for certain orthopedic injuries, where they'll, instead of doing a surgery, she'll, in some patients that this would help, they'll draw blood from the patient, they'll spin down the blood and pull out something from the blood called platelet-rich plasma that can help many tissues heal without surgery. She specializes in that. The rest of us specialize in minimally invasive surgeries and also rapid recovery robotic joint replacement. We've been doing computer-navigated surgeries for years, and also now we're doing partial knee replacements. We use the assistance of a robot for precision and also rapid recovery there. This is a newer way to do a total hip replacement that speeds up recovery and decreases pain. Currently, less than 1 in 5 hip surgeons in the nation perform this procedure. Fortunately, here at Florida Hospital Heartland Division, we are performing this operation on a regular basis. The rapid recovery techniques that we use multimodal pain management. I also inject what we call a magic cocktail during the procedure. And I'll talk about that magic cocktail later, but it's actually medication that we inject in the soft tissues where the surgery has occurred, and that decreases post-op pain. Pretty much everything we do is to minimize pain and improve recovery. When we do knee replacement surgery, traditionally a blood pressure type cuff gets put up on the thigh, it gets blown up, and that decreases the amount of bleeding during the surgery. But if you've ever gone somewhere and had your blood pressure checked, you notice that when they increase that blood pressure cuff pressure, it can become rather painful. So we've learned to do this operation with that special cuff on the thigh, but we've actually brought the pressures down to a lower degree and also decreased pain by doing that. And whenever we can retract soft tissues instead of cut them, we do that. And that's the whole idea behind the anterior total hip replacement, where we actually aren't cutting any muscles. Preemptive analgesia is something we're doing now, and this is actually based on the premise that it's easier to prevent pain than reduce it. And we actually administer analgesics or medications prior to the procedure. What we're trying to do is trick the body into not realizing actually how much has really happened. And by tricking the body in that way, patients experience less pain afterwards. So it prevents what we call central sensitization and pain amplification. Helps improve patients' recovery because they have less pain. All patients get TLC. And what we mean by TLC is Tylenol, Lyrica, Celebrex. These are 3 medications that act on pain in different areas and in different ways, but together they help reduce pain significantly. This is how multimodal pain management works. This diagram shows where the pain is caused and where the pain is perceived. Pain is really in the brain. You don't feel pain till pain signals get to the brain. The brain is what interprets those signals coming in from the body as pain. So whatever we can do to stop those pain signals from getting to the brain will help decrease pain. And how do we do this? Well, if you look at the slide at the very bottom, there is the tissue. That's where the trauma occurs. Trauma can be from an injury or from surgery. Whenever tissue is traumatized, it sends signals into the small nerves that are in that tissue. Well, we try and block the signals at that level, and what we use is local anesthetics and anti-inflammatory medications. Celebrex is an anti-inflammatory medication. A lot of our patients will get that before the surgery, and it helps prevent the signals coming from these tissues. We also use some local anesthetics that helps prevent some of these as well. However, some signals still get by that, and they make it up to the second image there, which is the spinal cord. But that's where our anesthesiologist helps us. A lot of our joint replacement patients have a spinal anesthetic done. And what that means is the anesthesiologist will inject a little bit of local anesthetic into the area of the spine, and it basically blocks pain signals from getting past that point temporarily. So that's another blockade of pain that we put in. However, some signals still get by there as well, and they make it up to the brain, and that's where we really rely on some of the narcotic pain medications that we're giving. Soft tissue preservation is another way to decrease pain and improve recovery. How do we do this? We do a lot of computer navigated surgeries, and with computer navigation we use computers to line up our cuts and to line up the replacement as we're putting it in, and by doing that we don't have to open up the tissues as much, therefore decreasing the pain by preserving soft tissue. Anterior total hip replacement is a great way to preserve soft tissue because we really don't have to cut any muscles anymore, and the incision is much smaller than with a regular hip replacement. The magic cocktail is I will inject that anywhere where surgery occurred. And what that does is it helps numb up those tissues after the surgery for up to 18 hours. Also, robotic partial knee replacements help keep the incision to a minimum and really preserve soft tissues, helping speed up recovery and decrease pain. MAKOplasty is a robotically assisted joint replacement. We can use this for a partial knee replacement, or we can use it for total hips. It allows us to do the operation to a minimal incision, has improved accuracy and improved outcomes. With the partial knee replacement, there's been various studies showing that these implants that we're putting in with the robot are implanted in a much more accurate fashion than if we do it without the robot. Also, there's improved outcomes. Patients, there's various studies that have shown there's decreased pain and improved function early on when we use the MAKOplasty robot. This allows for a rapid recovery. Most of our patients can go home either the following morning or the same day. I tell my patients that we can let them get up and walk the same day, and we have the therapist get them up and walking the same day. The knee feels like a more normal knee after this type of procedure. This diagram shows the robot also the computer, and also the implants that we use once the robot helps us basically sculpt the bone and prepare it for the partial knee replacement. The robot that's on the left side of the screen has a robotic arm with a burr at the end. At the very top you can see a surgeon's hand grabbing the robotic arm, and the robot has that burr at the end. In the center there is the computer. This robot has a computer. And what we do before the surgery is we'll get a CT scan, either of the hip or knee, whichever joint we're replacing. And with that CT scan loaded into the robot's computer, we basically plan the operation before the patient even gets to the operating room. So we've basically planned out the whole operation. Patient comes into the operating room, and then using the robot, we do the operation that has been already planned with the CT scan. So it's extremely accurate, and it's based off of that particular patient's CT scan, and the implants are specifically fit for that patient. And the implants that are used, you could see on the right-hand side of the screen. Anterior total hip replacement is a procedure that is less invasive and potentially less pain than a traditional hip replacement. It's something I'm very excited about, because I'm very happy to see patients do well, and they tend to do very well with this procedure. They're in a lot less pain and recover a lot quicker. It is a procedure that's more difficult for the surgeon. One of the reasons why only 1 in 5 hip surgeons in the country now is doing the anterior hip replacement, but it's easier recovery for the patient. It could be done with a special table, without a special table, but the special table is very helpful and makes the procedure very smooth, and it really helps with performing the anterior total hip replacement. Muscles are not cut during this operation. The hip is much more stable after the surgery. It's so much more stable that we don't have to use the traditional hip precautions that are used for regular hip replacements. You've probably heard people that have had a hip replacement, and they've told you, oh, they told me to put a pillow in between my legs, I can't squat down, I can't cross my legs. With the anterior hip replacement, we don't have to put those restrictions on the patient. What are the potential advantages of an anterior total hip replacement? Reduced hospital stay. We're looking at a 2 to 3 day hospital stay on average compared to a 3 to 4 day stay. It's a smaller incision, anywhere from 3 to 5 inches, but usually in the 4 to 5 inch range, versus an 8 to 12 inch incision. There's less muscle damage because the muscles aren't cut. The recovery is faster. We're looking at weeks instead of months, and it's a lower dislocation rate. Therefore, we don't have to use those hip precautions. Basically, it's less pain and a quicker recovery. This is a diagram showing an anterior hip replacement incision versus a traditional hip replacement incision. You're looking at a larger incision for the traditional hip replacement, which is a red line, and a smaller incision in the front for an anterior total hip replacement. You're looking at a 3 to 4 inch incision. This incision for the anterior hip replacement does vary with patient size. Obviously, the larger the patient is, the larger the incision has to be. Same goes with the traditional approach. Larger patients tend to require a larger incision. There are some limitations with an anterior total hip replacement. Larger patients may not be a candidate for an anterior total hip replacement. However, we've done patients up to 330 pounds, but it really depends on where the 330 pounds is. And that's very patient dependent on which patients are a candidate for this or not. If a patient's had previous surgery in the area of the hip, a lot of times we'll go with the traditional hip replacement, because scar tissue in the area can prevent the proper approach to the hip. With an anterior total replacement, about 20% of patients can get some what we call lateral thigh numbness, which is just some decreased sensation on the outer part of the thigh. It doesn't affect anything functionally. Patients can walk around normally, they just may have some numbness in the thigh. A lot of times it goes away over time. Revisions or replacements of replacements usually do require a traditional approach, or what we call a posterior approach. And the reason is we do have to cut, a lot of times through muscles, we do have to get a bigger exposure when we're doing a replacement for replacement. Multimodal pain management. This is very important in our rapid recovery joint replacement protocol. We rely on various medications given, and they basically block pain at different levels to decrease overall pain. And what we rely on is Tylenol, Lyrica, Celebrex. We also give some narcotic pain medication, and these in combination help decrease pain. We also give patients medications, specifically the Tylenol, Lyrica, and Celebrex, before the surgery, and this helps decrease pain after surgery and helps improve recovery. Florida Hospital Heartland Division, after a joint replacement surgery, it is very rare that we have to use morphine pumps like they were used in the past. That's something from the past, and we don't need to use that anymore since we have this multimodal pain management protocol. What patients can do. Patients can really help their recovery. They can take an active role in their recovery. There's many things a patient can do to get the best possible outcome from a joint replacement. One is avoid narcotic pain medications before surgery. We have a lot of patients that come in that have been in pain for many years and have been placed on elsewhere on narcotic pain medications because the pain has been so severe. The problem with that is people get used to those medications. Okay, and those medications have become not as effective for that patient. They basically get a tolerance to it. And the problem with that is some of these medications are what we use after surgery to help control pain. And if the patient is used to this, then the medication won't work when we really need them to work. Another important thing is decreasing weight before surgery. Increased weight can put more stress on a joint, so by getting a patient's weight down before the surgery, that should help. Diabetics really should have good control of their blood sugars before surgery. And a lot of times we'll check a hemoglobin A1C to make sure that the blood glucose is under good control. And a healthy diet is important also. It also really helps diabetics to keep their sugar in good control. Optimize medical issues, that's very important also. A lot of times we'll send a patient to their regular doctor or their cardiologist to get their medical issues in the best control possible. We basically want medical issues optimized or improved as much as they can before the surgery. That helps with recovery and helps decrease complications. And the most important thing I've found is a positive attitude. Patients that have a positive attitude tend to do a lot better than patients that don't have a positive attitude. So we do everything we can to give patients the best outcome possible. We do it through education, and Christine Griffin, our joint replacement coordinator, is instrumental in this because she will, in the class, will go through what patients should expect before, during, and after the surgery and helps them get this positive attitude, which really helps with recovery. The magic cocktail is, a lot of patients ask me what this magic cocktail is. It's actually a medication we inject, or a combination of medications we inject into soft tissues around the joint that's been replaced during the surgery, and it helps decrease pain. It actually will numb up those tissues for about 18 hours on average, and that really decreases pain after surgery. The medications that are in there is ropivacaine, which is a long-acting anesthetic, Toradol, which is a very strong anti-inflammatory, morphine, which is a narcotic, and then epinephrine is a medication that helps constrict blood vessels. And what it does is it doesn't let those medications be taken away by the body. So it helps keep them there for a longer amount of time to keep the pain control there longer. And we give this at the surgical site. Obviously, if a patient has an allergy to a particular medication, we either substitute it for a different medication or take that medication out of the magic cocktail. Physical therapy also has changed because of these rapid recovery joint replacement protocols. Most of our patients get up the same day as surgery, and they'll a lot of times walk with the physical therapist the same day as surgery. the anterior hip replacement really eliminates the need for that hip abduction pillow. The pillow in between the legs after hip replacement, we don't need it when we do an anterior hip replacement. And actually, some anterior hip replacement patients may start doing too much too soon. They don't realize they actually have had a full hip replacement and they start doing a lot of activities. But we want our patients to be active, so the physical therapist in the hospital will get the patient walking and doing their activities. Because of this rapid recovery joint replacement protocol, more patients are able to go home with home health or go home and then go to outpatient physical therapy than they have in the past. In the past, a lot of patients would have to go to rehab for a while. They could still go to rehab today if they want to, but a lot of patients are able to go home with home health now. This rapid recovery joint replacement protocol can allow for a shorter hospital stay, discharge to home instead of rehab, decrease pain and decrease need for medication after surgery, lower hip dislocation rate, a more normal life after a hip replacement, and really it's the future of joint replacement. How did we come up with this rapid recovery joint replacement protocol? It isn't something we just thought up one day and said this is a good idea. This is actually a combination of proven techniques that have been used in various parts of the country. Fortunately, I trained at one of the busiest joint replacement centers in the country, and a lot of my colleagues that trained with me have moved to various parts of the country and are also very busy joint replacement surgeons. So in collaboration with my colleagues around the country, I've come up with a rapid recovery joint replacement protocol that is specific to our patients here in Florida. And I've traveled and been involved in surgeries throughout the country and able to be able to provide this rapid recovery joint replacement protocol here. Florida Hospital has also been very instrumental in this, since they actually sent their joint replacement coordinator, their orthopedic nursing director, their operating room manager, their physical therapy director. They sent all those people with me across the country to basically analyze these different processes and then implement those processes that would be specific to our patients here in Florida, here at Florida Hospital Heartland Division. So basically I've combined these various techniques and I've implemented pretty much what I believe is the best rapid recovery joint replacement protocol for patients here in Florida, and it's really a cutting edge rapid recovery joint replacement protocol that's available here at Florida Hospital Heartland Division. Florida Hospital Heartland Division has the HANA table, which is very helpful for anterior total hip replacements, has a dedicated orthopedic unit. They're utilizing the rapid recovery joint replacement protocol, and Florida Hospital Heartland Division has been recognized by health grades and been ranked highly by health grades in orthopedics. It is also a high volume joint replacement hospital and pretty much the only high volume revision center in the area. And what I mean by revision center is a hospital that performs replacements of replacements. Very few surgeons perform replacements of replacements, but fortunately here at Heartland, Florida Hospital Heartland Division, we're performing these regularly. All the rooms in the hospital are private, and joint replacements is really what we do.